Hello, dear colleagues. I'm really glad to represent you the data on Asian cooperative groups on behalf of the National Society of Pediatric Hematologists and Oncologists from the Russian Federation, as well as from Eurasian Alliance in Pediatric Oncology. So my talk will be done from here, from Moscow, from Nikolai Blakhin National Cancer Center of Oncology. And I'm really glad that despite all the consequences, SIOP Asia 2020 or 2021 come true. So, how many pediatric cancer cases in Russia right now? What is survival and mortality? Let's talk about this more. During our work, I represented several data according new cases of cancer in Russia. So here you can see the total numbers of cancers in Russian Federation. The numbers are the same between the years. It's close about 4,000 cases, and the estimated overall survival is about 82%. So this is the data from the official cancer registry of the Russian Federation. You could see that the mortality in case of the Russian Federation decreases with the years from 3.4 to 2.8. And the major cause of mortality is about the progression, as well as the refractory disease, complications, relapses, and some other cases. Fortunately, late diagnostics are not the biggest issue in our case, but you can see we still have about 2% for this reason. And of course, as you know, we have a big network of departments and beds in different cities of our country. So the most of the departments are located in the European part, as the density of population is higher here. But also we have beds in the distant regions with a different number of cases, etc. Most of cases and most of the beds are located in the big multidisciplinary hospitals or pediatric cancer centers. Several departments are allocated in adult oncological centers. Usually it's like regional oncological centers or big oncological center like our center, Nikolai Blakhin. And of course, all of these centers are coming together and networking with the help of National Society of Pediatric Hematologists and Oncologists. One of the issues is the stem cell transplantation in Russia. And last time we had this beautiful Congress of SIOP Asia in 2019. I showed you this map. So we continue the work of improvement of our number of centers. You could see that fortunately we have new centers opening soon. And of course, as always, we are speaking how we could control our centers, how we allow them to communicate. So there are few major options how you could do this. Networking, common and single clinical guidelines, telemedicine, and collaborative studies. And today we're talking more about collaborative studies. And in this case, I would like to represent you several data sets. So initially, we started with our network more than 10 years ago. And during the last years, we have several major things. Nowadays, we have more than 1,300 participants in our professional society called National Society of Pediatric Hematologists and Oncologists. It's not only pediatric oncologists themselves, but also pediatric surgeons, diagnostic colleagues, and many others who is working with pediatric cancer care. And of course, the major aspects of our work is the different types of collaboration. For example, collaboration with the governmental authorities like Ministry of Health, advocacy units, professional standards and guidelines preparation together with and under the leadership of Ministry of Health. Also, we have vertically integrated medical information system, Russian CME system, and of course, it will not be possible without one of the biggest authorities called National Medical Chamber. And this society is in charge of professional standards and clinical guidelines. We also do juridical protection, expertise of regulatory laws, and of course, networking. And we could not understand, and we could not have any more, we could not have any kind of our work without international expertise and international collaboration. And of course, this is WHO, SIOP Asia, of course, and other international collaborative projects. One of these projects is Eurasian Alliance in Pediatric Oncology, EURADO. Also, of course, we are working close with the Russian regions. It's not only outreach program and educational seminars, it's also data collection, consultations, and collaborative network for trials as well as guidelines. Of course, we have different educational and scientific activities like congresses, seminars, schools. Also, science and educational projects, scientific and educational projects, as well as publishing of our journal and collaboration with parental organization and working with public relations. And of course, we are happy that the major part of our work takes, and we have a great collaboration for CCI. Another important thing is the official resources using for preparation of our work. It's not only clinical guidelines, and these guidelines is obligatory for usage in all of these centers, and these guidelines are on behalf of the Ministry of Health. You could see that we have new guidelines. I mean, we need to renew these guidelines each 2 or 3 years, and in 2020 we produced more than 35 guidelines. And of course, we have all required documents for pediatric oncology, hematology standard. What it means? It means that officially, fortunately, now we have our unique subspecialty, oncology, hematology, and we're working together. Because few years ago, you know, we speak that we need to unify pediatric oncology and pediatric hematology. And of course, we have new resources. First of this resource is a new building of Research Institute of Pediatric Oncology and Hematology. We have moved to new wards. It means that the number of beds increased from 150 to 275. And of course, we also have new departments. You see the different cities represented on this slide. And of course, one of the types of control of our work is the reference centers approved by the Ministry of Health. It means that government asked all of the physicians to have a reference in the biggest and the most experienced centers in the Russian Federation. And by this law, you can see the screen of this law here. They require to send samples for pathology, molecular testing, and imaging to these centers to have the official reference and to understand how you could treat the patients. And annually, more than 15,000 of patients could have reference here. It's not only malignancies, of course, because you could see that we have about 4,000 cases of malignancies. This is a differential diagnostics, etc., etc. And these 3 centers could have this work. And of course, you could not control this system without any kind of informational systems. And right now we have developing vertical integrated medical information systems for pediatric oncology and hematology with rather advanced scheme of work on the right side of your screen. And we could have the single coordination center through this type of medical information system to stratify patients for national center, as well is to leave them in the regional centers to see how they respond and monitor them after the treatment. And of course, all of this experience produced and made with the help of work of collaborative studies. So our clinical guidelines mostly based on collaborative studies. So this could be institutional experience, all Russian studies, or sometimes international studies. Here I represent several collaborative studies running right now in the Russian Federation. You can see that for different types of diseases, you could have two studies. This could give a choice for centers as well as for some sort of discussions to find the better day of collaboration. Next slides, I will represent you several advanced data from these studies. And of course, you know about our acute lymphoblastic leukemia group. We call them MB study. The number of cases are very big. In fact, this study covers more than 70% of patients with acute lymphoblastic leukemia in the Russian Federation. And you can see that we have very nice results of overall survival. And each time we are speaking about MB study, you are always asking, and what about other cases? Then if some of the centers didn't work in this MB study. So last years we found the answer for this. So our center, Nikolai Blakhin Center, works together with BFM Group with acute lymphoblastic leukemia study. And we asked centers which work on BFM protocol to collaborate with us and register patients. Nowadays, you could see that we have more than 300 patients registered. Of course, it's not so big study like MB study from Dmitry Rogachev Center, but we are trying to communicate, and the results from Nikolai Blakhin Center is quite well, is about 90%. So, of course, MB is the leading study, but this could also have a good potential for growing. Another study is acute myeloid leukemia study. We have an AML MRD study taking the data from all of the Russian centers, and this study have very nice results. Also, we have myeloid leukemia protocol in Nikolai Blakhin Center showed here with epigenetic therapy. So these results could have also be useful. Another important study is a lymphoma study. The results of protocol with reduced intensity of chemotherapy represented here, and the results are quite good. This study based on rituximab usage. And another study running in the Russian Federation is reduced intensity chemo also with the usage of BFM scheme, but with rituximab, and you could see that the results with rituximab is quite better in comparison of rituximab minus. Our centers included in SIOP umbrella study, and it's a great pleasure for us to register patients there. You could see the number of registered patients, and there are two major centers, Dmitry Rogachev and Nikolai Blakhin Center joined the study. Another studies are running in our country's neuroblastoma study. This is our COG-based protocol with the usage of immunotherapy, transplantation, and you could see what, for example, in Nikolai Blakhin Center during this year, we have more than 30 patients treated, 46 courses with mild seems to be quite well. Another scheme is and the number of cases included in this protocol. Here you can high-risk group. And this protocol running as a multi-center study in the Russian Federation based on NB, originally MB study. And of course, we could see the growing numbers of transplants in Russian Federation for children. So the number increased, and we hope that soon we will get to the required number of transplants, about 1,000 transplants for children in our country. Most of the transplants is allogenic. The same data is international data, and we hope that the new technologies will arrive. For example, CAR T cells for lymphoblastic leukemia. So this is a result of Dmitry Rogachev Center, and more than 80% of patients with very severe acute lymphoblastic leukemia survived at this time point, but we will see how it works. And another important study is CAR cells for solid tumors. We now have such experience in the Nikolai Blakhin Center, mostly on adults, and we could see the results soon and hope that this could work well. And I hope next few congresses I will give you our results of the future studies. So our prospects is a clinical guidelines improvement based on collaborative study, reference and telemedicine to cover all the cases of pediatric cancers, but in fact we have the same thing right now. We could see for a personal approaches for treatment, like personalized medicine, new methods of surgery and cell technologies. Also, next few years, we will open new technological centers, like 4 transplant centers for children. And of course, we hope to decrease mortality rates. And thank you for attention.